colleagues, welcome on board to our LEX Regulatory updates for the Russian pharmaceutical sector. My name is Maria Barzova, and I will be helping you follow the most important developments as of July 2017. In this video, we will be discussing the following issues: compulsory licensing, approval of TRIPS protocol, information technologies in healthcare, new federal law, off-label prescriptions of medicines, pending MOH initiative. Let's start with the compulsory licensing issue. On the 26th of July, the Russian president signed the federal law on approval of the protocol amending the TRIPS agreement. In theory, this may stimulate further amendments in relation to compulsory licensing in Russia. Under a general rule set forth in TRIPS, the generic copy may be produced under a compulsory license, mainly for the domestic market. However, the TRIPS protocol allows generic copies made under compulsory licenses to be exported to countries that lack production capacity, provided certain conditions and procedures are followed. Although the compulsory licensing instrument is a part of international law, the reasoning behind ratification of the TRIPS protocol by the Russian Federation creates concerns. According to the cover letter, approval of this law may allow local Russian manufacturers to use foreign patents in order to manufacture the medicines to provide help to foreign states. Or it may allow Russia to import medicines under a compulsory license if there is an epidemic. Moreover, the cover letter contains references to poor drug conditions in Kyrgyzstan, TB rice, and Tajikistan, HIV rice. The cover letter further states the following: using Article 31 bis of TRIPS, the Russian Federation could organize the manufacturing of generic medicines to provide such medicines to the former member states of the Soviet Union under compulsory licenses, provided that all conditions set out in the TRIPS protocol are met. This background is quite worrying, as it contains an important policy message, which may create additional risks for the Russian patients and the development of innovations. Therefore, we recommend monitoring further regulatory developments. Meanwhile, let's look at the next issue. On the 29th of July, the Russian president signed the federal law on amendments to certain regulatory acts of the Russian Federation on usage of information technologies in healthcare. Most provisions of this law enter into force on 1st January of 2018. This law must create a regulatory pathway for the development of telemedicine in Russia, which is good for the healthcare sector. Although this law may also create certain risks. During a meeting of the Russian government, Health Minister Veronika Skvartsova made the following regulatory forecast. After the enactment of this law, the government resolutions on the functioning of an IT platform for processing the information on state auctions for medicines and on the specifics of medicines descriptions for the purposes of state procurement must be adopted. These regulations may have both positive and negative effects. The risks may be specifically high in relation to determining the interchangeable medicines during the state auctions. Furthermore, in the second half of 2018, the new approach for determining the initial auction prices based on historical average prices of state supply contracts may be officially approved and legally implemented. The Ministry of Health believes that implementation of the reference pricing in state procurement may significantly lower the prices of state supply contracts and save budgetary funds. Based on this forecast, we recommend that the market players make an assessment of the existing prices of the state supply contracts in order to estimate any possible regulatory and commercial implications. Meanwhile, let's look at the last issue. On the 26th of July, the Russian Ministry of Health made available the draft amendments for allowing the off-label usage of medicines for public discussions. Today, the law does not directly allow off-label usage of medicines. The Ministry of Health believes that it is necessary to introduce direct regulations on off-label prescriptions in order to extend patients' access to necessary treatment. From the legal standpoint, it might be not sufficient to introduce the relevant amendments only into MOH sublegal regulation. It is necessary to resolve the issue of state procurement of medicines used off-label, It is also necessary to resolve the issue by including the usage of such medicines in the medical standards. Certain experts believe that this initiative may create additional opportunities for the Russian patients. However, other experts outline the risks related to the lack of evidence in relation to off-label indications, as well as interchangeability risks. Hopefully, these constraints will be eliminated following the public discussions. And this is all for today. Our next update will come in September. Please keep yourselves informed.